And that field of psychoimmunology started to really rise at the same time that we started to really see just a absolute everyday acceptance of high levels of stress, right?
Yep.
Dysregulation of the nervous system. And, we all face stress, but are you doing things to counter it in your daily life? That is really the question that, and most people don't do that until they face a crisis.
Right.
And then you do that. So, but it's so important in healing, right? Healing the nervous system helps with physical healing, your immune system, your hormones, your mental faculties, right? All of these things are really critical. The question becomes, how are you going to do it? How are you going to integrate it into your life? And again, why is it so important? It's because
Right.
you can't live in a sympathetic, hyperactive nervous system. And all of our PANS kids, it's rare that
Right.
I meet PANS kids and parents.
Welcome to Demystifying PANS and PANDAS, the podcast where we uncover the mysteries, breakthroughs, and hope behind these life-altering conditions. I'm Dr. Nancy O'Hara, a board-certified pediatrician, educator, and advocate with over 3 decades of experience helping children and families navigate the challenges of neurodevelopmental and neuropsychiatric conditions, especially PANS and PANDAS. These disorders can feel overwhelming, but here we'll break down the science, explore transformative treatments, and share stories of resilience and recovery. If you've ever wondered what's possible for your child or how to find answers, this is the place to start. Let's dive in. Hi, everybody. Dr. Nancy O'Hara. So excited to welcome Roseann Capanna-Hodge to the podcast. Roseann, you and I only live minutes apart, and yet it takes something like this to bring us together. We've been talking for a half an hour before we even started this recording, and you do so much, not just in neurotherapy, not just in the products that you sell, not just in your podcast, your courses, but just in being you and in bringing the message to a lot of families and practitioners that need to know about this disease and about how to take care of our kids. So thank you so much for being here. I really appreciate it.
Well, that means an awful lot coming from you. So I appreciate that. And we definitely are 2 committed practitioners, but first and foremost, we're mothers on a mission, right? So that we teach people about what PANS and PANDAS is, but more importantly, I believe we're purveyors of hope because there's such a misnomer that you can't move beyond PANS and PANDAS. And you and I get to see that all the time. We've been doing this for decades at this point. And I know it's hard, certainly both not just as a practitioner, but a PANS mom. This is murky stuff. At a minimum, it's murky. It's hard stuff. But there are science-backed ways to support the brain and body. And that's why I love we're having this conversation.
Absolutely. And that's so important. Science-backed ways, challenging disease, but they can get better. So first of all, just tell everybody a little bit about your story, how you got to where you are, all of that.
Yeah. Well, it's really interesting. This was a calling for me. You don't even know this about me. So when I was 5 years old, my mom's friend Angela asked me, what did I want to do? And I literally came out of my mouth, said I was going to be a psychiatrist, didn't even know what it was. And I remember Angela shotting a look at my mother like, psychiatrist, what are these Capannas doing? And so over time, I realized that I wanted to be a therapist because I really wanted to help people work through their problems without medication. And so I fell in love working with kids when I was in undergrad. Kids just have this magical way of, they don't even know they can't get better. If you're guiding a kid and you're like, hey, this is going to happen, and if you study X, Y, and Z, they're like, okay, And so I just saw that a little bit of support, a little bit of kindness, a little bit of just direction made massive impact on kids. At that time, I was working with kids that were inner city kids, right, that were struggling. And so as I quickly learned in 1997, I had my first chronic Lyme case, and I was working in a school, and I thought, what is chronic Lyme? I mean, you get bitten by a tick, you get some antibiotics, it's over. And this young man had so many symptoms of things that I was seeing, right? He had
Yeah.
separation anxiety. He was school avoidant. He had learning issues, attention issues, and sensory issues. And I am just a curious provider. I paid attention. And so he became my first understanding that there was more than just clinical mental health diagnoses of ADHD and whatnot. And I
Yeah.
already was integrative, because if you're working with neurodivergent kids, what it says in a textbook doesn't really always work.
Right, right. And it's amazing that you and I have similar but reverse backgrounds. At 5, I was saying I'm going to be a teacher. I'm going to be a therapist. And then I was actually a teacher, and I was lousy at it and took the easier route and went to medical school. And I say that all the time, that being a therapist, being a teacher, being on those lines is so much harder than what I do as a doctor. So,
I
and
don't
I
know if that's
remember,
true, Nancy.
well, I have to say there are challenges on both ends. But anyway, I remember,
Yeah.
what was that first conference that you did that we lectured together? That must have been like 20 years ago or more.
Yeah, I
Uh,
think it was something to do with PANS, or was
it,
it Lyme? I
Lyme.
mean,
It
I
was
would go
Lyme.
to the Lyme conferences, Nancy,
Yeah.
and you would listen and you would sit in there, and I would say, I'm never going to let my feet touch grass ever again. Like, you would be so scared and learning, all of these things that were happening. I mean, I don't think
Yeah.
people understand when you are a practitioner at every level and you take a commitment to learn about tick-borne illness, it is
Yeah.
never ending. It is incredibly complex,
Yeah.
because this is a very evasive bacteria, right? And more than bacteria, it's a very tick-borne illnesses can come in many forms, and boy, it can do a lot of damage.
Exactly.
But
And it's not
yes,
just about the infection, it's about the effect on the immune system, the metabolic system. And then what you and I want to talk about today, the nervous system,
that's
whether
right.
it's tick-borne disease or, strep or mycoplasma or whatever it is, what we're dealing with is how that affects the nervous system.
Yeah. And I say this all the time, because, always had complex cases, even when I worked in a school. And that is what people come to us and travel great distances for. That is the norm, even more
Yeah.
so than it was 10 years ago. I think there's so many layers and cases today. And I always like to tell everybody, I don't believe every single person that comes to me has PANS or PANDAS. I actually see people that don't have that.
Yeah.
So do I think PANS and PANDAS occurs more than people are actually diagnosed? Heck yeah.
Yeah. Yeah.
But I look at it fresh every time, and it is a clinical diagnosis. But when the nervous system becomes dysregulated, healing is either not possible at all, or it's going to be ineffective. It's going to be slow, sluggish healing. And what happened is that when I started doing neurofeedback, PEMF, biofeedback, I would get Lyme patients, elderly patients, little kids, all ages. And then their symptoms on the Lyme side would get better, right? So they'd come to me, most often anxiety or chronic pain probably would
Yeah.
be the two biggest things. And then they would say, hey, Dr. Rowe, like my Lyme disease symptoms of my joints and X, Y, and Z and my brain fog, it's all getting better. And that field of psychoimmunology started to really rise at the same time that we started to really see just a absolute everyday acceptance of high levels of stress, right?
Yeah.
Dysregulation of the nervous system. And, we all face stress, but are you doing things to counter it in your daily life? That is really the question and most people don't do that until they face a crisis.
Right.
And then, you do that. So, but it's so important in healing, right? Healing the nervous system helps with physical healing, your immune system, your hormones, your mental faculties, right? All of these things are really critical. The question becomes, how are you going to do it? How are you going to integrate it into your life? And again, why is it so important? It's because
Right.
you can't live in a sympathetic, hyperactive nervous system. And all of our PANS kids, it's rare
Right.
that I meet PANS kids and parents who are not completely activated.
Right. And that goes back to how integrated the immune system and the neurologic system are. I mean, they come from the same cells in the embryo. We know that 70% of the neurotransmitters start in the gut, at least. This is all so interrelated. So just stepping back a little bit,
Yeah.
from your perspective, how does PANDAS impact a child's nervous system and lead to this emotional dysregulation?
Yeah. I mean, there are multiple ways the nervous system gets activated, right? So, at the most kind of common sense level is honestly just the trauma of
Yeah.
this activates the nervous system. The trauma of, your child having massive tics on the floor and not getting better. The trauma of your kid punching holes in the wall. And sometimes for people it's an overnight switch, right? Or sometimes there's some symptoms there, and then I always say a sudden acceleration, a worsening,
Yep.
which can be very confusing. So the trauma of not getting proper care, all of that is incredibly activating. And we sometimes think, right, like, you and I are tough people. You think, okay, well, I'm tough, I got through it. Your nervous system is going to hold on to trauma, right? So it's going to activate your system, right? Move you from a calm parasympathetic state into that sympathetic dominant. And that in itself, right, is an Achilles heel that sometimes people they ignore it at the expense of, I'm only going to work on the medical. But, trauma lives in the cells, and it passes. And then the infections, the toxins, the waste products from infections and toxins can cause we know that it's a misdirected immune response. We also know that more and more of our kids are not just getting neuroinflammation, they're getting systemic inflammation. And once your body is in these activated states, your resources will move to try to figure out, why is your body in this sympathetic dominant state? And that means you have less nutrients available, your microbiome starts going down. Number one cause of, besides infection, of your microbiome really not getting the proper balance is stress. Okay.
Yep.
So you're taking the probiotic and you're doing all that, but your system is so activated that it's never moving forward. And I actually see the improper balance in the gut microbiome being one of the final Achilles heels, right?
Yep.
That individuals don't get better. And so it affects your hormones, it affects your neurotransmitters. All of these things pull away from your body properly detoxifying and actually addressing that infection, that toxin.
Yep.
And it is very simplified, but that is the truth. And so when we get the nervous system regulated, you get an accurate response, right?
Yep.
To whatever treatment that is. And that's why, like, so many people come to me and they're going to the finest physicians. They're getting actually proper care, but nothing is getting them over that point, or they're stuck in a constant flare pattern, Nancy, like up and down, up and down, up and down. And really, this is a big part of it. Improper detoxification is a big part of it too. But again, everything's so intertwined.
Yeah. And it reminds me so much to remind the parents and the practitioners that are listening or watching, we can't increase the stress just by trying to get something into our kid. So many times I hear, I'm chasing my kid around the house to get the supplements into him or to give him the medication that he needs. And I always say, what's causing that issue is the stress that you're causing in doing that. Let's step back. We've got to look at all the lifestyle pieces, all the vagal nerve stimulation to improve, our kids' ability to respond. If we're just adding to that stress by adding one supplement or one medication on top, and every kid has 20 things they've got to take, and we're not dealing with how we're improving their parasympathetic tone or decreasing their fight or flight response, they're not going to get better.
I couldn't agree with you more. And in fact, like, I have people who come to me simply for the fact that they've been recommended 20 vitamins, right? Medications, combination of things. And again, Nancy and I are super pro on these things, but they can't get it into their kid. right?
Yeah.
And that's because they're so activated, whether it's their nervous system from the infections or the whole trauma of the event. It's often a combination of both, right?
Yep.
And what we do is we back away a little bit, and food too. Sometimes most of our PANS kids, I would say that 70% of them struggle with restrictive eating. How are we going to force feed
Exactly.
kids? We can't.
Exactly. And we
So
make those eating disorders worse.
oh my gosh, we totally do. And there's such a line between eating disorders and OCD. I most often have OCDers start turning into an eating disorder, not the other way
Yeah.
around. And eating disorders are very, very tricky from a treatment standpoint because when kids get so low in their nutrient intake, we then start worrying about cardiac issues,
Yeah.
is not to be, it's in getting treatment for that. I mean, that's a whole other story. It's
Right.
like addiction care,
Right.
eating
And
disorder care. It's a business. You're never going to
yep.
get places that are high quality because they know that these people relapse. And so
Yep.
there's a real negative message because they're like, you're going to fail, so we'll see you again. I don't believe in that. I don't believe anybody. There's always degrees of getting better, but everybody can get better. And not because I'm focused on nervous system regulation. I'm focused on nervous system regulation because it's so important,
Yep.
right? And there's so much to be said about, yes, okay, so you're like, Roseann, Nancy, what do we do? How do we get these supplements in? You've got to calm yourself first. You've got to
Right.
co-regulate.
Right. And it reminds me too of the PTSD that a lot of these families go through, even after years after the kid is better. And it's still within the cells of the parent there. And
Totally.
believe me, I was one of these parents. I mean, I remember a case, and my son had said to me, I'm not doing well, Mom. And I'm like, okay, is it Bartonella? Is it Borrelia? Is it strep? Is it viruses? Is it mold? Is it? And I'm going through all the stuff. We're in a hotel together, for 4 nights. I'm not sleeping at all. Finally, after 4 nights, he says to me, Mom, it's about a girl. And it was in that moment that I realized, you know what? There's still a lot of work that I
Yeah.
have to do.
No. And
And
that was a good reminder that there's just normal developmental stuff,
exactly.
right?
And I had this
Yeah.
conversation with a family last week. Their child was getting bullied, and the dad kept saying, I've got to do these 20 things. He needs this medicine and this supplement and this, and he needs more of it. He had gotten the kid's vitamin D level to 234 because he kept pouring vitamin D into the kid that he didn't need.
Right.
They weren't doing any of the therapy. They weren't working together as a family to help address the issues that were there. They were still stuck
Oh,
in the
yeah.
old pandas that
Yeah.
had been regulated and taken care of, but the family dynamics, the school dynamics, the therapeutic pieces had not been. And so, I always say it takes a village.
Totally.
It
It
takes
reminds
all of
me,
us.
one of the most traumatic, experience in our PANS journey. My Max, was bitten by a tick when he was 22 months old. And I already was working with people with Lyme for 9 years before. So, I was like, what's going on? But one of the most traumatic experience actually was he got a tonsil and adenoid removal. And there were just a lot of things. It was just a very scary thing. He wouldn't let go of me physically for 10 straight days. And, I was doing intakes, and what are in a lot of intakes? Tonsil and adenoid removal. And I could feel the activation in my chest. I could feel myself tighten, right? And I'm
Yeah.
not an anxious person, but I'm a very aware of how I respond to things and how I physically feel. And so I basically said, I've got to do some somatic therapy, which is a great therapy for trauma. And,
Yeah.
even though I was doing neurofeedback and biofeedback and all of that, it did help. But I actually needed some form of, it's not a high talk therapy, but I needed to way to release it from my body, and I needed to talk about it with somebody. And it was a game changer for me because I didn't even realize. So I knew in that moment, because it was very clear connection where it was an intake and somebody said tonsil and adenoids, and I would be like, oh, how did it go?
Yeah.
You know, but it was infiltrating in other ways.
Yeah.
And I also wanted to show up, for my family as a better human being, but all the kids I worked with, I wanted
Right.
to be able to tell them, like, you got to have hope, and it's so easy with these activations, just being a parent with a kid struggling. It doesn't matter what the struggle is, that kid who's being bullied, those parents went right back to the
Yep.
whole pants thing. And, I hope they were to understand, like, your kid's being bullied, that requires a completely different intervention and therapy around that. But,
Right.
we often think when you have a trauma back there, it's going to come up and bite you in the butt when you don't want it to bite you in the butt. So you got to put it away
Yeah.
in the right place, and a professional can help with that.
Absolutely. So how do you help families, parents integrate like these, I think you call them brain first solutions
Yeah.
into a care plan to
Yeah.
get better outcomes?
Yeah. And just so I know, like, I only work with a tiny amount of people one to one. And as much as I love working one to one, there's lots of things that I do, including my podcast, where I'm telling you what to do. Right. So I understand the commitment that it takes. And PANS, is not a one and done therapy. Right.
Right.
There, you takes an integrated approach. I talk about a 5-pronged approach. But what I like to do is I have a protocol called the COMS protocol, because I tried to integrate my work into something that's simple. And the first step is the C is co-regulation. And what I found, why I loved working with kids, is that kids don't know that they can't get better, but boy, parents will try to outthink themselves, right? And they start driving the worry train, and they're spinning just like you were in the hotel room for 4 days, sweating it out, thinking, what, we just got rid of this. What's going on? And so when we get caught in our own worries and fears, we activate. I mean, that's
Yeah.
normal, right? But you've got to put your own oxygen mask on first. I mean, it really is true. The problem is we don't prioritize, when we're PANS parents, we don't prioritize our own mental wellness, our own
Right.
physical wellness. I've done that.
Right.
And how can you do that? Very simply. Well, you can. So, you can do simple things like breath work, and you got to do these things as much as you possibly can proactively. So when the poop hits the fan, your body will go right into a breath state. It will do it
Yeah.
without effort, because people will
Yeah.
say, well, I can't do it. Right. But I promise you can. I always say this is just like brushing your teeth. You
Yeah.
get a habit, you brush your teeth, they're not as yellow. You don't get cavities. All these good things happen. And yet
Yeah.
most of us are brushing our teeth hopefully twice a day. So
Right. But you have to practice these. I mean,
practice
and
it.
practice it at times when you're not in that state of crisis.
That's right.
Where you have a little glitch, like the bus is late
Yeah.
or, the
Yeah.
kids are fighting or whatever it may be. Practice it. I remember when I started doing this work, I had a mantra that I would repeat in a loop over and over and over again
Yeah.
whenever I get these feelings
Love
to
that.
get the squirrels in my head out of the
Yep.
way. And
I
I've
love a
talked to parents
mantra.
about
And in
that.
fact, I
Yeah.
give all my parents who work with me a individual mantra just for them. So like, I can see success.
Yeah.
People will say things like this too shall pass. I mean, that's a great mantra, because our brain 10x will see, it recognizes a negative in 1/4 of a second. But it's up to 20 seconds before your brain will see a positive. So we are
Mm.
wired, due to caveman stuff, to see negatives, and we have to actively work to change that. And when we get stuck in that negative thought pattern, or our body is feeling uncomfortable, we're going to activate. And activation is normal, but we need to tamp it down. And so, breath work, prayer, mantra, nature walks, yoga, biofeedback, all these things are ways to regulate. You need to do it. The science says 10 minutes a day. 10
Yeah.
minutes a day. You actually, after 40 days, can change your brain functioning permanently with
Yeah.
just 10 minutes of these activities a day.
And by doing it as a parent, you can model it to your children.
Exactly.
Your kids can see you taking that breath or going for that walk outside or doing a yoga move or whatever it may be. And it can be getting into their DNA.
Yeah. I mean, that's what the M is in the comms, but it's sort of
Okay,
like when
tell me all about that
oh no,
protocol. Go
but
ahead.
when you say model, right? Our parents, my mother Philomena, she would yell at us to not yell. You know what I mean? With a wooden spoon in her hand. So, just for emphasis, she didn't ever get me with a wooden spoon. My sister, maybe. But you do model it, and it's so significant because kids absolutely absorb what you're doing. We know they're not as absorbing at the same level what you say, right?
Yeah.
Certainly when it's positive, but they're lecturing these kids, right? When our kids are activated, and listen, most PANS kids, there's different kinds of activations. There's understimulation of the nervous system and there's overstimulation. Understimulation could be that regression of learning, memory problems, shutting off, being resistant to things. Where overstimulation, right? Our PANS kids like my own, when they're explosive, when they're just sensory over the top
Yep.
activated, right? Those are the kids where we wind up putting a lot of intervention because we don't have a choice.
Yep. Or even I would add the kids with intrusive thoughts, that
Yes.
OCD that's only in their thoughts. They may seem like they're underregulated because
Yeah.
they're withdrawing, they're pulling in, but those kids are even more activated because they're all up in their head.
Oh, yeah. When you see their
So,
brain map, Nancy, literally their brain communication is on fire. And, OCD with intrusive thoughts, it always starts with intrusive thoughts. We're not seeing compulsive behaviors until it's pretty activated.
right,
And once it's on the outward, a lot of OCD is completely irrational, but it can sound rational. So parents get themselves caught in what we call an accommodation pattern, and so they're not doing anything on purpose. They're being great parents, but they're rescuing their kids. They're
right.
participating in rituals, and the rituals can be sneaky and come in, right? Some
Yeah.
some OCD with PANS is like, where did that just come from? Like it happened overnight, and parents will say, "Well, it happened on February 12th, of this year," and then you're like, "Okay, well, it's clearly PANS." But it is. I'm so glad you brought up OCD because it is incredibly common. And not only is incredibly common, it's often misidentified as
Yeah.
anxiety and mistreated.
Yeah.
And if you have PANS and you have OCD and you're only focusing on the medical treatment, I'm telling you, you're wasting your money and you're wasting your time because when OCD comes into the brain, it forms a behavioral habit and it gets what's called a negative reinforcement. It gets reinforced, reinforced, reinforced. And it is
Yep.
as tough to break, but not impossible as addiction. And you really need an experienced person with PANS and OCD, and they're out there. And you
Yep.
can get the right kind of therapy, but it's so critical for the parents to get the actual counseling on how to deal with these intrusive thoughts because they're
And
sneaky.
I think that's so important. And I
Yeah.
talk to the parents about this all the time. They'll say to me, well, my kid can't do that, or they won't do that, or whatever. I'm like, you need to do it
Yeah.
because you need to not I call it feed the beast of
That's
this
right.
disease. And you need to learn the therapeutic approaches to help your child get better because you're on the front lines. You're
A
there with
hundred
them every
percent.
day. And if you are feeding that negative feedback loop, as you say, then it's going to be so much harder. And so, as you and I were talking about before, I'll kick people out of the practice if they won't do therapy because
Yeah.
it's just so important to getting better for the family, you
Yeah,
know.
and once OCD, I mean, shows up, right? So of course nobody wants to get rid of their OCD. They're going to tell you they don't want to get rid of their OCD. You're going to see anger flashes, you're going to see pulling back, you're going to see all kinds of negative avoidant behaviors because guess what? They actually are getting a bit of relief every time they perform a ritual,
Right.
even though every time they perform the ritual, it actually moves the baseline up and up and up, and it becomes harder to stop. That's what a negative reinforcement, just like what Dr. Nancy O'Hare was just saying, that it is feeding the beast. We call it feeding the barking dog. And the problem is parents don't know what they don't know. Once they know, like parents come in and they're like, oh, I feel so bad. And I was like, please don't feel bad.
Exactly.
Don't feel bad. is so sneaky. It's going to get you to participate if there's, when your kid asks you, did anybody breathe over this plate? And you answer yes, you're actually feeding the barking dog every time you answer. The right answer, which a therapist can help you who does exposure response and prevention ERP, is should be like, well, what do you think? And your
Right.
kid's not going to be happy with you because you're not giving it relief. But what's going to happen is they're going to go like, sort of like when the Hulk's trying to come out, right? Bruce Banner pulls it back in. And then the next day, they might ask you the question and you're going to look at them, or maybe 10 days later, and they're going to say, I know that's my OCD fear.
Right.
And it's not.
Right.
There's nobody breathes on this.
Yeah.
I'm so proud of you that you recognize that. That is actually really, truly how you just give the 1-2 punch to the OCD.
Exactly. And what you're saying in there, one of the phrases I would use is the parent's not saying, shut up or don't talk about this. They're in a way saying, I get it, but not feeding it.
That's right. Yeah.
I think both of those are important and something you need a therapist to help you do and work
Absolutely.
through the individual situations. Absolutely.
Yeah.
So,
and because
go ahead.
who would ever think, Nancy, like that you're, when you say to your kid, oh, did you leave the bathroom light on? Yeah, I left the bathroom light on. Who would ever think that you just got suckered by OCD and
Yep.
you're actually now making the nighttime ritual go from 20 minutes to 30 minutes?
Yeah.
And then it's going to go to 40 minutes. And, people come to us and sometimes their kids are stuck in these OCD rituals. Obsessive thinking has to occur an hour or more a day for it to be OCD, or ritualistic behaviors. But some of our kids are stuck in it literally all day long.
Oh,
And the
yeah.
whole family is set up to participate in it.
Yep.
And they don't know how to stop it. So the good news is ERP, as hard as it is in the first couple of weeks, I'm not going to lie. It's like when you had a knee surgery and your knee was bothering you, and then you're like, that is the most painful thing I ever experienced. And then 10 days later, you're like, feel fantastic. I wish I had done that earlier.
Yep.
That's what it's like, because you're removing something that in some way produces a feeling of relief. And
Right.
so it's going to be hard. So I hope that's a hopeful conversation. I spent so much time talking to my PANS people about OCD, and we have an amazing OCD specialist on our team, and it is the number one thing that brings people in a crisis, because it will escalate if you don't put that sucker down, to be honest.
Absolutely. Absolutely. So
Yeah.
before we move on from it,
Yeah.
though, is there anything else you wanted to tell me or our listeners about the CALMS protocol?
Oh, yeah. So the CALMS protocol is like my simple way of saying, how do we deal with behaviors, right? And I know that behaviors in PANS, autism, complex ADHD, these are big behaviors, right? But it doesn't matter if this is a normal developmental issue or it's a big issue. These are the things that I say to everybody. So step 1, co-regulate. However you got to do it. I don't care if you're going to go hide in the garage and you can do some breath work. I like to do mine in the morning. I do multiple things throughout the day. I start with prayer. I have a very conscious, prayer process, but also I like to tell everybody every time I sit down, which could be 30 times in a day, getting up and down, I actually take 5 seconds, 10 seconds, and I do a visualization. I ground my feet. I often just do a quick deep breath, and it just integrated into what I do. I don't even know that I'm doing it anymore. I just do it. So I don't want you to think you have to go get a massage every week. That's great if you're doing that. Some of my people like to get out in the morning before the kids get up and just get some light on their face. That's great. It ain't happening here in the Northeast. I'm not going out like it's 20 degrees out. My mother-in-law. So that's important. So the A is avoiding personalizing. I think this becomes so tough in PANS. They're like, is it a flare? Is it a behavior? It doesn't matter. You're not going to personalize this. This is not about you. If you are being triggered, you got something you got to work through, right? Maybe you have trauma from parenting, your own parenting, right? Your own parents. It happens all the time. I mean, that's just what it is. I lightly say my mother chased us around with a wooden spoon, but she just did it for emphasis. But I also know that people that can be scary for people, and that people were beaten. And I don't want to disregard it, and say,
Right.
okay, my own father was horrifically abused as a baby. He was beaten in his sleep.
Oh,
He is a very different guy though. Like he isn't affected by trauma in the same way. He's like a rare bird, and he just is a different person. Like he
mm,
really goes out of his way to do kind things for people. So I wanted to say that I understand the intergenerational impact, right? So he
right.
actually underparented us to avoid hitting us, right?
Yeah.
So the L is to look for root causes, right? So when we are not activated, when we are not personalizing their behavior, we can say, oh, okay, so he's been sneaking gluten and the behavior's out of control. We're going to talk about the gluten, or wait a second, his girlfriend broke up with him, right? Maybe that's what's going on. It's so hard to actually be what I call a parent detective when you're
Yeah.
activated, right?
Yep.
You're
Absolutely.
you're just not going to see it. Right? You're going to just go back and you're going to be just like you said, you're going to go back to this is a pants flare.
Yep.
Maybe it is a PANS flare, but guess what? You don't have to freak out. You don't have to go look for a new provider or find a magic wand or any of that stuff. You can go back to what worked before. Always start with regulating the nervous system. But like in my house, vitamin A is magical.
Yep.
Certain things, and we just add them in. We just add them in
Yep.
because guess what? We know that PANS kids respond to anti-inflammatories. If your kid's antibacterial or antiviral, you just add them in. You don't have to wait for a big blowout. But again, you got to be a detective. So the M is
Right.
that modeling, which we talked about.
Right.
Not perfect. I say 80%, you're doing a good job, right? And when you do mess up, you do yell at your kids, you do freak out because they didn't get their homework in. You're going to come in and you're going to apologize and you're going to talk
Exactly.
to your kid what you should have done.
Yep. So key. So key. Making
Okay.
amends
I
to
mess up all the time, Nancy.
exactly. We all do. We're all perfectly imperfect.
Yeah, I mean, absolutely. And then the S is for support and reinforcement. So I think people just don't realize how much even neurotypical kids need a lot of reinforcement. Like
Yeah.
even regulation of the nervous system. We are not born regulated. Our environment shapes us towards regulation. Yes, some kids have a temperament that's easier. I have two boys, one kid, like, he came out like Buddha, like I mean, he inherited a lot of the Hodge genetics of this kind of chill kind of thing. So, but regulation is a set of skills that can be learned, right? And we just have to reinforce. When you got it together 80% of the time, not perfect, and you are helping your kid regulate together, you're co-regulating, you're supporting them and doing the same strategies you're doing. Um, all of this becomes a lot easier and they're much easier to learn strategies because the problem
Yeah.
is, once you're super activated, we talked about what happens in the body, but your frontal lobes go offline. You're just not absorbing. You're not hearing in the same way. And, I always like to say, like, if you, it's like you had a big project and, you got a great, 8 hours of sleep and you exercised and you had, you knew you had 10 hours to do something that took you 4 hours. You're going to go in there. It's going to be easier. It's going to be more pleasant, right? You go in, you didn't sleep. You've got
Yep.
2 hours to do a 4 hour thing. It's not going to be great, and it's that same way. So when we prime that nervous system, even at the height of infections and toxins, this will make a huge difference. The problem is you've got to get over the mindset that it doesn't and that you don't have time because you
Yep.
can build 10 minutes in throughout your day. Just like I said, every time I sit down, and it's even more important when your kid is actually being activated by an illness or whatnot. It makes a big difference. It will help them get
Yeah.
over the hump and it will prevent that big destabilization that always seems to happen over and over again.
Exactly. And a couple of things I was thinking about as you were talking. One, one of the other things that I do and I talk to my parents about and my kids is ending their shower every day with a cold shower. 30
Mm.
seconds. It just resets. It's a mini cold plunge. And it may force you to take those deep breaths. It may force you to be more present in your body where you are right now, or it may just wake you up a little bit. But little things like that, like your 10 seconds that you take when you sit down every time, those little things throughout the day.
Makes a
And
huge difference. Yeah,
huge.
for
Huge. And then
sure.
the other thing I was thinking about is we're talking about parents and helping them navigate their child's dysregulation. But I also think it's very important for all the practitioners that may be listening or watching, because so much of the time, especially when we're new to this disease, or we don't really look at the big picture, we want to dive right in. Okay, this kid's worse. What do I need to do? What antibiotic do I need to change? What supplement do I need to add? And I urge the practitioners to also use these. Take a deep breath, be present, look at the whole picture of the child, not getting so wrapped up in what am I missing? What didn't I do? I've got to fix this. No, it again is that whole picture of calming down your activation also in dealing with these families.
And I think in for the practitioners, I mean, I've been working for 33 years in mental health. Just validating that this is some
Yeah,
hard stuff is
yeah,
so important. I know it sounds so little, but so many of the times they go right into the medical part. I think validating this is hard. Also letting them know that there is no quick fix, but we
yeah,
can absolutely reduce symptoms, and here are the best things that can help. And where you need to spend your time. I know I'm very strategic. That's just my personality. It's how I do things. So I spend time strategizing and helping them dissect, what didn't work and why. Because a lot of times I make people go back to treatments because it was the wrong time or they were too
yeah,
activated. Instead of being, a chaser of therapy, or even sometimes a lot of times people do what I call sprinkle therapy, right? So they try a little of this or a little of that. So with practitioners really helping to validate, but also letting them know what the path is and what needs to happen, even not just in your care, because that's what I spent a lot of time doing. Like, wait, I need you to go back to Dr. O'Hare because it did help, but I don't think you did it long enough.
right.
And helping them to understand, because boy, are they scared. And boy, is there a lot of, I mean, I'm in the Facebook groups and it's scary in there. And sometimes there's things in there that are amazing, but sometimes it's just so much fear. And
Yeah,
when you let fear hijack you, which is normal for that to happen, but you have to actually stop it from happening. And so, having a practitioner who helps to speak to the worry and the fear, you don't have to rescue. You can just validate that's experience, but you can also say, how are you getting support on that? Because that's
yeah,
important.
yeah,
And we got to prioritize that for sure.
yeah. And we're talking about how to help parents and practitioners and therefore helping their children. But also, I'll have some parents who either have a child with severe autism and PANS pandas, or who is really in the throes of this, that the parents don't really feel the child can access it. And I know you also have other techniques like your Calm PEMF, the
Yeah.
pulsed
Right.
electromagnetic field.
Yeah.
Talk about that a little bit.
Yeah, so I don't have it on my desk. I developed a product called Calm PEMF. And PEMF is pulsed electromagnetic field therapy. It's been around a little over 30 years. And it's a type of therapy that actually does three things. One, it changes the way the cells are communicating, improves the health of the cells. And we're really starting to understand in so many ways how much we need to improve cellular health, not just for things like PANS and PANDAS, but aging and all these other things. Puts you in the parasympathetic state, which you heard about all the good stuff of that, right? And that's the unlocker. That's the unlocker of a lot of, healing, but also moving forward behaviorally because you have the physical space to do hard work. And then it really reduces inflammation, then improves detoxification. So I have a lot of kids who are nonverbal autistics with PANS or without PANS. And so they're just very activated. They can't sleep. They may have toileting issues, behavioral issues, all the things that you can think of. And so this is just a simple device that calms the nervous system. It's easy. I wanted something portable because I have a mat and I love a mat. And, I'm not going to trash talk any devices. They're all great, right? They just do different things.
Right.
But a mat, nobody wanted to sit on a mat. So this is something you can pop in your pocket. It comes with a fanny pack. But there are brain tools. Your kids might be able to use heart math, biofeedback, really inexpensive, easy to use, but you have to be more cognizant and you have to sit down and make the time for it. Only 5 minutes and it will make a huge difference. And then, of course, we have neurofeedback. But when I have super, super activated individuals, it can be really helpful if they're willing to do it. If they can't
Right.
physically sit down and do it, it's not going to help. So
Yep.
there are many, many brain tools that help to regulate both the actual brain waves, but also you've got to get that nervous system regulated. And there are
Right.
easy ways to do it.
Right.
And,
And since you brought it up,
yeah.
some of our listeners and viewers may not really know much about neurofeedback,
Oh,
and you
yeah.
certainly are an expert in that as well as many, many other things. But just tell them a little bit more about
Yeah.
what it is and how you use it.
And just so everybody knows, I started working with these neurodivergent kids and I was like, these meds are not helping these kids. They're making it worse. And, I already was doing diet and supplements and stuff in the 90s, long before other people only naturopaths were doing it then. And so I memorized all these books and I fell into brain tools like neurofeedback. So neurofeedback is a really highly effective, been around, over 50 years. It's a way to reinforce the brain for producing a healthy combination of brain waves, and you use technology to do it. There are all different kinds. I do EEG neurofeedback, which is more controllable for a brain that is this destabilized, whether autism, PANS, complex ADHD. And you're literally putting sensors on a person's head and on their ears and they're getting visual and auditory reinforcement. We use movies and shows, and their brain will reset itself. It will learn to move from an unhealthy to a healthy state in 2 to 3 seconds from the first time you're hooked up, and it will just to get this reinforcement. Now, like exercise, you need a lot of sessions. Definitely less than 20 sessions is a waste of time. We
Agreed.
do about 40. That's typically. And what is the goal of it? Regulate the nervous system and reduce specific symptoms. That's why I use EEG, because I can have a dyslexic with PANS or just a straight dyslexic or dyslexic with ADHD. And I actually can go in and address the way their brain is processing phonemes, or I can change their executive functioning. And there are practitioners all over the world. You always want to get a certified practitioner. And you can go to bcia.org to get a board certified practitioner. I love neurofeedback. It's a commitment. But it really is effective. And the cool part about it is the research as far as 10 years out shows that the changes in the brain are sustained. And so that's pretty awesome. Like it gets a bum rap because they'll say, oh, meds work quicker or this. It's just not what I see.
Right.
So I'm not against meds. I'm against it being the first line of defense, psychiatric meds. So we too quickly go into psychiatric medication, especially when they're doing like 15-minute intakes, Nancy.
Oh, I agree. And, as Sid, and I've said this before on this podcast and many others, Sid always calls it name it, blame it, tame it medicine. So we name it anxiety or depression or OCD, and we blame everything that's going on that. And we want to tame it with an SSRI or an SNRI. And without getting at the root cause. And neurofeedback is one of many tools we have that can get more at that root. And as you said, be more sustainable without just putting a taming blanket on the symptom.
And what I just found again in those 90s, even right from the beginning, is that if I wasn't doing to help something very directed towards regulating that nervous system, that they weren't going to absorb the learning. It didn't matter how amazing that social skills therapist was or the dyslexia reading instructor, whatever learning they're doing, It's not going to happen. So a lot of people will say, well, we've done talk therapy and it stunk because they were too activated to access it most of
Right.
the time. That is what happens. And so the learning has to happen. And also, too, learning isn't just for the child. A real therapist who works with kids will only take you on if they're doing parenting work too, because you're not a bad parent. We just don't know how to parent a kid who shows up like this. I had to
Right.
do a lot of work when I had a really activated kid. I was like, well, that wasn't in the plan. I did a preconception detox. I had planned for him to go to a Montessori school. Life has another plan. You have to adapt, right?
Right.
And there's a process. You grieve a little bit, you move on. You don't get stuck
Yep.
in it, and truly, Nancy, the parents who do the best, the kids who do the best are parents that have a sense of faith and a sense of positivity for the future. It doesn't mean that they don't experience the rough things, but they don't live in it. And
Right.
that takes their own regulation to be able to do
Right.
that. And I can't say how critical and how much that is a definer in the success of the treatment of a child that I'm working with. I can have
Yep.
two cases, and that kid whose parents are more of faith and positivity, that case could be 10 times worse than this kid's case, and they'll get much better results every
Yep.
single time.
Yep.
And I
Yep.
say that because I want you to understand how important mindset is, and for practitioners to say that to parents, right?
So agree. Yep.
Yeah, and you don't have to say in a way that's insulting. You can say, "Hey, listen, this is what I say to my parents, like, we've gotta tend to ourselves. This is activating. You gotta prepare yourself for a marathon. A
Yep.
marathoner doesn't work like a sprinter, okay? They're gonna change their diet. They're gonna do this. They're gonna practice every day. So you develop that, and guess what? You
Right.
all have the ability to do it. I know it's hard. As I always say, I walk the walk. Like, I've
Yep.
done this too,
Yep,
you know?
exactly. And I think what's so important too is that, yes, strep may have been a trigger that led to pandas in your individual child, but we live in a toxic world where all of our children are going to be inundated with so many other toxins. And it's not about the
Right.
strep, it's about the dysregulation of our immune system, of our neurologic system, of what we're talking about in our parasympathetic and sympathetic system. And it's about resetting all of that because your child's going to be exposed to the EMF and the mold and the toxins and the chemicals and the pesticides and the bullying and everything else. Doing all of this lifestyle management, this five-pronged approach, the calms protocol, whatever you use really can help you deal with all the things that come down in your life
In
in
life.
this
Yeah.
marathon
Yeah.
of,
And the kids that I see, because we have so many kids that are adults, right? That we
yeah,
work with, which is amazing. And the kids that I see do really well in life, they embrace that, okay, I've got to
yeah,
regulate my nervous system. They embrace that, okay, I
yeah,
got to eat pretty clean. I need to do these things for my own mental health. And they are super awesome adults
yeah,
because life comes with stressors, right? I was talking to my girlfriend the other day and we're both in our 50s and she was like, "What's going on?" And I was like, Same stuff you got going on. My friend's dad died. This one's this is that. This is life." So
yeah,
it's not perfect, it's messy, and we need to do things to be able to support it,
yeah,
because every day can be a challenge. And so kids who get through this and really learn these skills and learn to embrace them really do better in life.
absolutely. And we live in a soundbite world, and so much of the time I think we as parents or practitioners come in, what's the magic bullet? What can I find that's going to change this?
I
And
got my magic
really
wand, Nancy,
and,
right on my desk.
and that works. Yes. Yeah.
Yeah, right. Because everybody would come here. There is no magic wand. If we knew
Right.
it, I swear we would share it.
Exactly.
Like, and
Exactly.
and I don't want people to feel overwhelmed. That's why I simplify things with, like, okay, there's a comms thing. Like,
Right.
be logical. You can do this. Like, I don't
Right.
care. I had the house with the holes punched in the walls, people. I understand. Like, I've been in your shoes. And maybe there's days you can do more of this and other days, but the more you do it, the better you can handle. And also the flares that go up and down start coming less and less and less. And you have micro flares.
Yep.
And that's something that everybody can work towards. I really do believe in that. So,
Exactly. Yeah. And then not when you get a micro flare, not having the PTSD to worry and live in the fear again that you're going to go back to the big flare.
that's right.
Reminding yourself with those micro flares as you come down. It's a saltatory pattern. It's not a straight
Yeah.
line in any way.
No.
You're
Yeah.
going to get these little flares. That's what, like you said, that's what life is.
Yeah. And I even like we had COVID this summer and I said, Max, okay, you got COVID. So about 5 days after this resolves, you might feel extra cranky. You might feel more irritated. And, this is how the best way to address it. And he was like, okay, you know, and he got it. He understood. Now it took time to develop that. It's not the first time I've said that to him. And, kids can learn and prepare for things. You're teaching him that you are uncomfortable, right? And
Yep.
instead of just reacting, he can say he came down, he was like, okay, you said a bath would help me. How many times should I do that? I was like, every day, and he listened. He wanted a little coaching about what he did, and then he just did it. And
Yep.
guess what? We didn't have any flare.
Yeah, exactly. And, you mentioned the bath, and that reminds me of one of the other things that one of the few supplements that I think can be a game changer, which is also on your website, the neurotastic magnesium. We often will put magnesium salts, magnesium chloride in baths
Love
to,
it.
love that. And as much as there are no magic bullets, I think you and I would agree, especially the magtine that's in your magnesium, can help many things in
Yeah.
brain health and sleep and calming. And I wanted to mention that one because I had seen it on your website, and I think, I'm
It's the
all
only
about all
supplement
of
I
things.
made, Nancy,
Well,
because
that tells you something about how
it's
good it
so
can be.
essential. But
Yeah.
also just to know, I take a magnesium bath pretty much every night. Like
Yeah.
it's a different kind of magnesium. We need it. It's the most used nutrient in the body. And, when you're this activated, whether infections, toxins, stress, whatever, we are just burning through it,
Yeah.
and there are all different kinds of magnesium, but L-threonate and glycinate and malate are really designed for the brain. And
Yeah.
that's why it has all three in there. And it really just acts differently. Not that citrate isn't important for pooping, right?
Totally
Um,
agree.
not all our kids have it. That's why you have pooping issues. That's why it's not in my magnesium. You can get that
Yep.
cheap elsewhere.
Yep. Yep.
But it is a magic wand kind of thing. It's something that I say if there's one supplement, it's that and D. It's
Yeah.
D, yeah.
I agree. I
And a
agree. And
third,
I'll
I'd
add
say
some
zinc.
oils and well, zinc, absolutely.
Yes,
But oils and
totally.
phospholipids
Yes.
also. So,
Yeah. I
uh,
totally agree. And some of the essential fatty acids, some kids are so resistant to it, but it is definitely in the top 5 for me.
right,
Like those are the critical ones. But I know
right.
that if I can get them to take magnesium, there's going to be at least one positive symptom reduction. Like there's going
Yeah.
to be at least one. So that can be a game changer. I had 2 adult nonverbal aggressive autistics, their parents tell me, this is making a difference day one. I was like, I know, like it's so exciting to see that. And it didn't stop everything. It just gave a little bit more space to start
Right.
using some of the other interventions.
And like you were saying before, sometimes they're so activated, you can't access some of the other things. And so
Absolutely.
if you can bring that activation down a little bit with magnesium threonate, for example, then they may be able to access more of these tools. And
A hundred
so it's
percent.
the interplay. And I wanted to ask you, I always talk about the 3-pronged approach. You mentioned the 5-pronged
Yeah.
approach. So I think some of our prongs are the same, but tell me your 5-pronged
Yeah.
approach.
So obviously immune,
Right.
infections, detoxification, then you have behavioral therapy, and you have nervous system regulation in
Yeah.
there as well. So, behavioral therapy and nervous system regulation are two sides of the same coin. And
Right.
when they occur together, they work super synergistically and cut down on behavioral therapy. That's the other part of things, right? Because if
Exactly.
you're regulated, again, you can access your thinking brain, your rational brain. And people say, "Well, my kid's so smart." It doesn't matter how smart you are. Once you're activated, you're just not able to think in the same way. You can't pay attention in the same way. We know that as
Right.
adults, right?
Right.
Yet we expect something different from our kids. So those are the other pieces and that I feel really hold people back. And I do feel detoxification and nervous system dysregulation are things that are not prioritized in the same way.
Yeah.
And they're about lifestyle. And I
Yeah.
think that's hard for people, again, because this idea that there's one thing that's going to fix it. Like people are like, I'm doing IVIG, it's going to fix it. Okay, good luck with that. Call me.
I know. I know. Exactly. But I hear you. I think I melded a little bit of that together into my three-pronged approach because I put all those three of those into one
One.
therapeutic branch, and they are interlinked. But I think, you're right in that we have to look at each phase of the activation: neurologic,
Yeah.
immunologic, metabolic. So anyway.
And it's hard. This is all
Yeah.
hard stuff. Like neither one of us are saying this is an easy path.
Right.
You already know that. What we're saying is this is an easier path in the sense that this is what you're working smarter, not harder, right?
Yeah.
Because every time you delay proper treatment to somebody with PANS and PANDAS is increased suffering for that child and that family. And that is what you're doing by training more practitioners, right?
Yeah.
Because and there's been such an improvement in practitioner growth in the last 10 years. Nowhere near what it needs to be. We need all our frontline workers, all our therapists, all our medical doctors to not only, agree that PANS exists,
Right.
and there's proper treatments, but to guide them to the right
Right.
professionals. And I think that is just a whole other can of worms that needs a lot more growth.
Absolutely. So, you and I have been doing this a long time. You said 33 years. You must have started when you were like 6, but otherwise I get it. But what would you tell your younger self now? What would you do differently? Or what advice would you give your younger self with everything you've learned over the past 30 some odd years?
I honestly feel that as clear as I am with people, and you're very much the same, I would have been even clearer early on. I would have
Mm,
blended my compassionate self with this. Guess what? If you don't regulate the nervous system, nothing is going to stick.
yeah.
Nothing is going to move forward because if you got to calm the brain first and then everything else follows. I wish I was stronger in that
Yeah.
because people come in and it's like they're drowning in 2 feet of water and they don't realize they can put their feet down. And so they get overwhelmed. And so I have changed the way I do things. I tell them right up front when you meet with me, I tell them exactly what is going on and exactly what to do in the first 5 minutes. Then I explain because
Yeah.
the explanation gets lost. And so they need to know this is what it is. So, I think I've always been somebody who was a purveyor of hope, but by being clearer just how important that is, I mean, it gets the job done and people have much greater results. And,
Yeah.
they're hearing that more. So I probably would have started a podcast sooner too, because I love that they hear you and they get to listen
Yeah.
to you and develop a relationship, and I know it's been so impactful, like, this is so impactful to both parents and practitioners,
Yeah.
and, I've been blogging forever, but blogs are different, you don't get to hear my saucy self, you know?
Yep.
You don't get
Exactly.
to see my
I
my
love
magic
it.
wand,
Yeah.
but I think that's probably what I would say is, like, this is critical. Do not
Yeah.
ignore it.
Yeah. And you have so much more than we've even talked about on your website, which is Dr. Roseann, right?
Yeah,
Oh,
DRROSEANN.com.
right. And is there anything else that you're working on or that you're doing? If you haven't listened to Roseann's podcast, please do. And they can find that on YouTube and
You
all
can
the other
find it everywhere.
platforms.
Yep. You could
Yep.
just search Dr. Roseann and you can go to my page, Dr. Roseann /podcast, and they'll have the buttons to whatever you listen to, Spotify. But it's technically called It's Gonna Be Okay, but you're more likely to get it to come up if you just search Dr. Roseann. But yeah, I would say listen to my show, and if it resonates with you, share it with people because I design episodes to be they're short episodes. Most of them are under 15 minutes and they are designed to be lifelines for parents because
Yeah.
there's a lot of people out there who are not credentialed giving wrong information to parents.
Yeah.
And you need practical behavioral tools, and that's what I try to do in every episode.
And you do it so well.
Well,
And
thank you.
is there anything else of what you're doing you wanted to tell people about?
Well, I'm writing a book
I think that's amazing.
about dysregulated kids. So that's not going to come out until 2026, but it's going to be a game changer in the world. And between me and my publisher, we're really trying to change what people think about parenting. And a lot of what we talked about will be in this book. I want to make things easier for parents because, 50% of parents feel overwhelmed.
Yeah.
And they just had a research study by Cure.com that said 1/3 of parents have thought about killing themselves because of parenting. And it's not okay, and I'm sure it's even larger in our groups of parent distress. So, please, if you feel that way, just get help. Nobody ever regrets help. They only regret when they don't. And there's no shame in that. And there are great therapists that can help you process this, and you shouldn't feel bad because you're getting therapy and maybe your kid doesn't want to. So for sure.
Right.
So, you and I were game changers out in the world. And so that's what my next steps are about. I'm always trying to change the conversations away from medications and put it back in the hands of parents who have way more power than they realize. They just don't know the right steps. And hopefully, the things that I'm doing simplify it so that they can, have better connection with their kids and much peaceful homes, regardless of what's going on. There's always a way to make things better.
Yeah. And Roseann, thank you so much for everything you do. And I'm so looking forward to your book and watching all the other projects that may be coming up and, empowering people, empowering other therapists, empowering parents is something you've done for so many years and done it so well. So I, for one,
Thank
really
you.
appreciate that. So
that means an awful lot to me coming from you. So thank you so much. That makes me pretty verklempt, to be honest. So
love the word. I love that. Well, thank you. And any last words you want to leave our listeners and viewers with?
I mean, just parents, you got the power and take a minute and regulate yourself and change will happen.
Yeah. Thank you so much, Roseann.
Thank
See
you.
you again soon.
That's it for today's episode of Demystifying PANS, PANDAS. I hope you're walking away with insights, tools, and hope to help you and your child on this journey. If you found today's conversation valuable, be sure to subscribe so you never miss an episode. Share this podcast with anyone who might need it. It could be the lifeline they're searching for. And if you have a moment, leaving a review helps us reach even more families who deserve answers. Also, for more information, training, and community, check out our website, drohara.com, and join our annual membership. And remember, every step forward, no matter how small, brings us closer to healing and understanding. Until next time, be present, be hopeful, and we look forward to seeing you next time on Demystifying PANS, PANDAS.